Good morning. I am John McMillan.
I'm Miranda Thigpen. We decided to do our vitamin and mineral project on vitamin B5, which is the layman's term for pantothenic acid. So, what is pantothenic acid? Pantothenic acid is an important part of a coenzyme involved in fatty acid metabolism. Pantothenic acid is an essential nutrient that is naturally present in some foods. It can be added to other foods and available as a dietary supplement, meaning you can take it in the form of a pill, um, like a vitamin, like we take every day. You can take this one the same. Is it a mineral or a vitamin? Obviously, it's a vitamin. It's vitamin B5. It can only be consumed as a vitamin. It's not a mineral, also. It can be found in the following food items: chicken, beef, potatoes, tomato products, whole grains, and egg yolks. Although vitamin B5 is in a wide range of foods, um, it's best consumed and our body uses it the best if we consume it as turkey breast, sunflower seeds, mushrooms, animal liver and kidney, various fish, brown and white rice, and canned mushroom gravy. So what is vitamin B5 used as? It is an acyl carrier protein for fatty acid synthesis. It also helps synthesize acetyl-CoA, which is the most preferred form. It's preferred over the carrier protein by 85%. It's whenever you're making acetyl-CoA, it's an irreversible process. In order to form acetyl-CoA, one carbon is removed from the 3-carbon pyruvate, and a coenzyme, which is derived from the B5 vitamin, is added. So vitamin B5 in relation to exercise. There's no reason to believe that our body absolutely needs vitamin B5 to be able to exercise, actually perform movements. But the food that we get vitamin B5 from is what our body needs to be able to exercise, like the protein and the carbohydrates. Our muscles can't move without having protein or carbs, so it's really important that we do take in this vitamin.
All right. So as far as intake recommendations go, um, they only use the adequate intake recommendations because there's not enough evidence um, in a deficiency or excess amount to support the devisement of an upper intake level, the estimated average requirement, or the recommended dietary allowance. So as far as the adequate intake goes, for a newborn up to a year old, they need 1 milligram per day, and then a year old to the toddler at 3 years, they need 2 milligrams, and then 4 to 8 year olds need 3 milligrams. So it's obviously a progressing state, and then once you get to 9 and 13, you have 4 milligrams a day. And then 14 years all the way up to 70 and older, they need about 5 milligrams a day. So it's at a pretty stable rate once you reach that age. Vitamin B5 plays a very vital role in pregnant and breastfeeding women, and that's noted by the rising rate that you see for pregnant women. They need 6 milligrams a day, and then breastfeeding mothers need 7 milligrams. And it seems that there's a connection between pantothenic acid and the hormone prolactin that's produced to mothers who are breastfeeding, that's targeting the mammary glands. So some conditions and signs from excess and deficient amounts of pantothenic acid are seen here. In excess, the body will excrete the B5 through the urine as well as through diarrhea. The excretion in the urine can result in dehydration. It can also result in edema, which is like a swelling in a certain area of the body, as well as joint pain. Calcification in the blood vessels can also occur. And then as far as deficiency goes, it's rare. Not many cases have been brought forth that are directly related to vitamin B5 deficiency, but patients have complained of numbness and burning of the hands and feet. They've also had headache and fatigue throughout the day. There's been noted irritability and restlessness as well. So like they've had sleeping problems, sleep apnea at night, and they've also experienced symptoms of heartburn, nausea, as well as vomiting and diarrhea and the loss of appetite. And a psychological symptom of depression can also come from these physical symptoms as well, due to like the chronic the chronic experience of all these symptoms. So a patient can become depressed because of all these. The deficiency can cause the inability to recover from any kind of exercise bout or long periods of light to moderate body movement. And there's no known interactions with medicine for disease and treatments, but some doctors have used supplements of B5 to treat dietary deficiencies, alcoholism, acne, allergies, breathing problems with asthma, ADHD, and a general malaise, which is like general referred pain in the body. A scholarly article, upon reading, reported that there was a relation between pantothenic acid and the low-grade inflammation, and it was represented by a protein elevation. The inflammation had a critical role in the early stages of atherosclerosis, which is like a blocking in your heart, and the pantothenic acid may have had an antioxidant effect in that inflammatory process. A couple interesting facts about pantothenic acid. It has a very high boiling point of 1,025 degrees Fahrenheit, which is very considerable, seeing that the boiling point of water is 212 degrees. So it explains that it's significantly higher than that of water. Pantothenic also is a Greek root, which means from everywhere, and it's because a vitamin has been found and it can be consumed through so many different foods and supplements. So our test question that we devised, we wanted to target athletes, saying that they usually intake vitamins and supplements in very high amounts to give them enough energy. So our question would be, why would an athlete need sufficient amounts of vitamin B5, and then what would happen if he wasn't to obtain enough amount of that same vitamin?
Okay, so the answer to our question would be that athletes must be able to synthesize acetyl-CoA for fat and carb oxidation. Acid is the initializing factor for the beginning of the citric acid cycle, which is super important because we have to have that citric acid cycle. If he has insufficient amounts, ATP cannot be produced in the form of light aerobic exercise or in recovery. And as Hobbs says, we only breathe so we can make ATP. So making ATP is extremely important. So having insufficient amounts of B5 would not be very good. And here are references that we used. And that's all.